What happens if Delamanid doesn't work for drug-resistant TB? Imagine battling a tough infection that refuses to go away. That's what happens when Delamanid, a newer drug used to treat multidrug-resistant tuberculosis, doesn't seem to work. Delamanid was developed to help fight strains of tuberculosis that don't respond to usual medicines. It works by targeting the bacteria in a different way, offering hope for patients with resistant forms of the disease. But sometimes, even with this new drug, the infection persists. When Delamanid doesn't work, it might mean the bacteria have become resistant to this medication as well. Resistance develops when bacteria mutate and no longer respond to the drugs meant to kill them. This makes treatment more complicated because the bacteria are now resistant to multiple drugs, limiting options. It's a sign that the bacteria are adapting, and the treatment needs to be adjusted accordingly. In such cases, doctors will look at other treatment options. They might try other second-line drugs that are still effective against resistant bacteria. Sometimes, newer medications like Bedaquiline are added to the treatment plan. Using a combination of different drugs can help overcome resistance and improve the chances of success. The goal is to find a regimen that works specifically for the patient, based on drug susceptibility testing, which shows which drugs the bacteria are still sensitive to. Even if Delamanid isn't effective, it can still be part of a broader treatment plan. Sometimes, drugs that initially seem ineffective can contribute to combination therapy, especially if the bacteria are partially resistant. But safety is also important. Delamanid can cause side effects like changes in heart rhythm, which might be more concerning if the drug isn't helping. In such cases, doctors may prefer other medications with fewer risks. Treating drug-resistant tuberculosis is very personalized. Healthcare providers will regularly monitor the patient's response through sputum tests and clinical assessments. If the bacteria are not clearing up, they will reassess and modify the treatment plan. This might involve switching drugs, adding new ones, or adjusting doses. Supportive care like nutritional support and managing other health conditions also play a vital role in helping patients recover. In summary, if Delamanid doesn't work, it signals the need for a careful reevaluation of the treatment approach. Doctors will use drug susceptibility results and clinical judgment to craft a new plan. The fight against resistant tuberculosis is complex, but with the right combination of medications and ongoing monitoring, many patients can still find a path to recovery. Always remember, it's essential to work closely with healthcare professionals for personalized treatment options and to ensure the best possible outcome.